Hi, my name is Mark Lubitz, and I'm here with this week's medical research update. First up is an interesting opinion piece on the changing role of the United States Preventative Service Task Force as a result of the Affordable Care Act. The Affordable Care Act mandates that Medicare covers preventative services that are deemed an A or B rating by the USPSTF. At its core, this is most likely a good thing. However, it brings into uncertainty the role of the USPSTF. The task force has a historical role on basing recommendations simply on very good evidence. Now that their recommendations are being used by Medicare to make policy decisions, it brings into jeopardy their ability to make decisions simply based off of hard evidence and science, and makes it maybe a political decision. It remains to be seen how this new regulatory power will change the USPSTF. This next article is about a new drug called ribociclib and how it works on advanced hormone receptor positive breast cancer. This drug, which is a CDK4 and 6 inhibitor, was given to women with advanced stage 3 or 4 hormone receptor positive HER2 negative breast. Progression-free survival was longer in patients receiving ribociclib as opposed to standard of care therapy. However, adverse effects were also significantly increased. It's important to note that these adverse effects include neutropenia and other myelosuppression, making it an important risk to weigh when determining whether or not it's worth extending this progression-free survival. Next up is a trial that looked into the risks and benefits of antiretroviral therapy in pregnant women who have HIV. Women who are HIV positive in their second trimester of pregnancy with CD4 counts above 350 were given either zidovudine or full-fledged antiretroviral therapy. The transmission of HIV from mother to the baby was significantly lower in patients who received full-fledged ART as opposed to zidovudine alone. However, adverse maternal and neonatal outcomes were also significantly increased in patients receiving full-fledged ART therapy. These adverse outcomes include preterm labor and decreased birth. Thus, like always, the risks need to be weighed against the benefits when determining therapy for HIV-positive pregnant mothers. Last up is a rather somber article out of France regarding a phase 1 trial of a fatty acid amide hydrolase inhibitor. The fatty acid amide hydrolase inhibitor has been shown to increase endogenous cannabinoids and can have an anti-inflammatory and analgesic effect. These positive results have been seen in a couple phase 1 and phase 2 trials. However, in this phase 1 trial, we saw 3 out of 4 patients develop a rapidly progressive acute neurological syndrome. One of these patients ended up dying. MRI revealed microhemorrhages in the brainstem, the cerebellum, and hippocampi of these patients. 2 patients saw improvement, however, 1 died and 1 has residual memory. This study highlights the importance and danger of early clinical trials to determine the safety before the efficacy of the drug. That's all I've got today. Make sure to check back for more.